Hi guys, this is Surbi from the Mom Store and welcome back to Expert Talk with the Mom Store. Today we will be talking on a very important topic which is postpartum depression. We have Dr. Sweta Parikh who's going to be joining us. Let's see if she's already there and we can add her. Yeah, we're just waiting for Dr. Sweta Parikh to join. Here she is. Hello, Doctor. Hello, Dr. Sweta,
Hello.
Mom Store.
Hello. How are
Yes,
you?
I'm good. How are you?
I'm fine.
Okay. So a lot of people have started joining. So I think we can just jump into it and get started. A brief
Yeah.
introduction before we start and about the topic that you're going to talk about in yourself. 22% of women in India suffer from postpartum depression. These are figures which are coming out of a survey, but in all practical purposes, this figure might be higher because a lot of these, postpartum depression and anxiety was unreported and unnoticed across many women. Today in this session, we want to talk about why does postpartum depression happen when women least expect it, because motherhood is a journey that they prepare for several months, if not years. How can how can a woman realize that she's suffering from PPD, or how can family members be more aware about it? And lastly, what are the ways to deal about it? So, ladies, we have here with us Dr. Sweta Parikh, who's MD in Psychiatry and founder of Swasti Spine and Mind Care. She specializes in women, child, and adolescent psychiatry. So, welcome to the forum, Dr. Sweta, and we are very glad to have you here.
Thank you.
Okay. All right. So, Dr. Sweta, let's dive in. What is postpartum depression? And what are the symptoms and why do some women go through this?
Well, postpartum depression is a type of a depression that occurs generally after pregnancy. It can also have an onset during the pregnancy, during the immediate postpartum period, or it can go on even till 1 year after pregnancy. So generally, the symptoms of depression they start appearing by the end of about a month or so. But then certain females, it also happens that the symptoms start appearing about 3 months, 4 months, even after the pregnancy.
Hmm.
So it can go on till 1 year, and if untreated, it can go on for a few years also. It generally does not remit on its own, and the symptoms are quite disabling, and it also affects the functioning of these females. So it becomes very difficult for them to even take care of their child. The
Hmm.
newborn infant suffers because of that. The family also suffers, and the female also has a lot of guilt related to that. So it is a very severe form of depression, and around 10 to 15% of women worldwide they suffer from postpartum depression. And in India the numbers are pretty high, but then we don't diagnose them. The awareness is not up to that extent that the people come forward with such symptoms. Even the family members are not that aware that they should be taking care
Hmm.
of the, and certain, so it goes undiagnosed and even leads to suicide and other problems.
Hmm. So, ma'am, you spoke about some symptoms. So, what are these symptoms? What does a woman feel, and how does it? What is the difference between just having an anxiety panic attack and actually being diagnosed with PPD?
Yes. So, postpartum, there are a lot of mood changes that occurs in most of the females. We can say that about 85 to 90% of the females have certain changes in their mood immediately postpartum, because there are a lot of hormonal changes occurring in them. So, in the first week, that is first 48 hours specifically, all the female hormones, that is estrogen, progesterone, those hormones, the levels drop down drastically after the
Mm-hmm.
birth of a child. So because of that, there are a lot of mood changes occurring in them, and it leads to irritability. They don't feel good about having a kid. They also have doubts about that. They're severely anxious, can't go off to sleep, and along with that, there is also this phase of adjustment to a new life. So all those things are very stressful to the women. So
Hmm.
during that period, generally, most of the females, they have certain changes in their mood, but then we can't classify that as depression. That is
Hmm.
something temporary, goes on for a few days, and then they adjust to the new surroundings, to the new thing that they're going through in their life,
Hmm.
new phase of their life. But then, if it lasts for a longer time, if it lasts for more than 15 days, we can say, and if it is very severe, it also affects their functioning. It also affects their caretaking if they're not able to take care of the baby because of the mood changes that they are having. Then we can
Hmm.
classify it as depression.
Hmm.
Also, there's anxiety. There's a difference between anxiety and depression. So,
Hmm.
just being anxious about the kid, about the way they are taking care of the kid, whether there might be a lot of insecurities also, that they
Hmm.
might not be able to take care of the kid, or how are they going to manage things financially, emotionally, sparing time enough for the kid or not. All those insecurities, I think most of the moms would go through. But then,
Hmm.
specifically in depression, it happens that they're not able to cope up with the anxiety.
Hmm.
Along with that, they also feel low. They're extremely sad throughout the day, no matter what you talk to them. Even if they get some good news, or if there's something to be happy about, they can't feel that happiness. So it's a continuously low mood that they keep on feeling. Along with that, they also start losing interest in everything around them, even in the things that they used to be interested in, some hobbies or whatever they used to like before
Hmm.
they went before the postpartum period. So all those things also, they start losing interest in that. There also might be a
Hmm.
lot of negative thoughts about their kid, about also the family, the spouse. They start getting suicidal thoughts sometimes in severe cases of depression. So all
Hmm.
those things, we can figure out that this is not just their anxiety, it is something more severe, and they might be going to postpartum depression.
Hmm.
Uh, there are also a lot of factors which can lead to postpartum depression, and most of them are biological. If they have already had an episode of depression in the past, or any kind of other psychiatric problems, like some sort of psychosis, or there's this psychiatric illness called bipolar mood disorder.
Hmm.
So if they have ever had such episodes in the past, the chances of getting postpartum depression increase by 25 to 30%.
Hmm.
So that is also a major factor, and such females who have already gone through certain psychiatric problems in the past, they should always be screened during their pregnancy for signs of depression.
Hmm. Right. And so sometimes women, because they are going through so much, they're having a physical change, biological change, emotional change, they may not realize what's happening to them, right? Because suddenly a new member of the family is completely dependent on them for all its nutrition. So how can family members, keep a watch out if for such behavioral changes, or just ensure that the woman is fine and it's all good. So what are the signs to watch out for family members?
The family members, they need to realize that they need to be more sensitive towards the female, because most of the families, they believe that having such mood changes postpartum is normal. That's what
Mm-hmm.
everyone goes through, but it is not so. So they need to be more cautious about the symptoms during early pregnancy. Even during the first few months of pregnancy, in the second trimester, third trimester, the symptoms might go on increasing. The female, she does not feel happy during her pregnancy. She's not interested. She's not able to do her routine work, or pursue her hobbies. So all these are common things that can give an idea, at least to the caretakers, that something is wrong. They need to be prepared for something more serious, even during the postpartum period. So, they also, the most common symptom is irritability. These
Hmm.
females, they start getting irritated over such trivial issues which they did not used to do so previously.
Hmm.
So that is how this is something very specific to postpartum depression. The irritability that they feel is extremely high. They get short tempered. Even the most trivial of things irritate them. So,
Hmm. Hmm.
in otherwise depression, which is not postpartum, in any other episode of depression in women or in men, irritability is not this severe.
Hmm.
The
Hmm.
other symptoms of depression can be similar to that in postpartum period, but then the irritability, that is something which happens specifically in such
Hmm.
periods.
Yeah.
And about the suicidal thoughts, they should, if someone in the family realizes that the female is going through depression or is not feeling well, they should always inquire for suicidal ideas. If they have any such thoughts, have they made some
Hmm.
plans about committing suicide, or they just feel like not living a life anymore. So those things,
Hmm.
if they are asked, they would reveal. These
Hmm.
are certain symptoms which need to be asked. They need to
Hmm.
be taken. I mean, they won't come out on their own. They won't express themselves on their own. But if asked, most of the females, they would express that yes, they are getting such thoughts.
Hmm. Yeah. So in India, traditionally, the whole motherhood has been painted as a sacrificial picture. A woman is the primary caregiver. She's in charge of the nutrition. She has to take care of the family. And do you think that setting such unreal expectations put a lot of pressure on women once they become moms because they just feel that they're not able to handle everything, and that their mothers or grandmothers did it much better than them, and this whole comparison thing that comes, does it also lead to such thoughts and depression? Do you think that there has been a rising trend in PPD cases over the last few years?
Uh, yes, that is one of the major stress factors that women today they go through. Previously, there used to be some other factors which used to be stressful to women. But with the change in our cultural backgrounds and in the basically women have started working, they are dependent on themselves and not dependent financially on the family. But along with that, there also comes this thing that they're not able to take care of the families as much as they used to do previously because they can't contribute equally on both the fronts. So this is a new thing coming up in our society, that the females are expected to be the way they used to be a few years back or a few generations back, but then they are also working and financially becoming independent. So this is a major change in the society, and that has affected everyone. So maybe the transition phase, we are going through
Yeah.
transition, and that is what is affecting us. So
I
in
think
the
you're
coming
right there.
generations, this might not be a stress factor anymore, but yes, today it is. So any
Yeah.
kind of stress in the pregnancy, during her pregnancy, any kind of stress that can trigger postpartum depression. So
Mm-hmm.
the chances are pretty high that a person going through financial difficulties or domestic problems or issues with the spouse or with family members, uh, difficulties at workplace. So all those things are certain. They are factors which do contribute to postpartum depression. We cannot pinpoint that one thing has led to that, but then these things do contribute.
Yeah, right. And I think you're right in saying that, women have moved forward in terms of education, going out there and working. But at the same time, the level of expectations that were there for them in terms of household care and child care has not changed. So the
Yes.
responsibilities have only increased, and, everybody expects all the women to be superwomen, which is setting very, very tall standards. What are some of the ways to deal with postpartum depression? Does it have to be medication, or if somebody realizes that, they are feeling low all the time, and what is it that they can do, or should they seek medical care immediately? So, how should this?
Um, yeah. So we can classify postpartum psychiatric conditions into three groups.
Hmm.
The mildest form is postpartum blues, or the mood changes that most of the women go through after delivery. So the postpartum blues, about 80% of the females they go through that. That is something in which only supportive therapy or just being understanding of her problems and the changes that she's going through. So that would help her. I mean, just being supportive and giving her reassurance that things are going to be okay. So that would help her overcome the postpartum blues. Uh, a more severe form of that is postpartum depression, which
Hmm.
generally happens in about 10 to 15% of the females after the delivery.
Hmm.
So in that case, medicines are needed along with psychotherapy, that is supportive therapy is needed, reassurance is needed, and we can go ahead with medicines if they're having severe symptoms. Medicines, there are lots of options available, and these are safe during lactation period also. So that is the main concern which most of the family
Yeah.
members and the moms would also be concerned that the child should not be affected, and if they are lactating, whether the medicines have any side effects on the kid or not. Most of the medicines they are secreted in breast milk. It is
Hmm.
not so that they won't be transferred to the baby, but then the side effects are not seen in the kid. The
Hmm.
quantity in which it is secreted in the breast milk is not that high to cause any effect on the child. So they are
Hmm.
very safe, can be definitely given, and they should be given to the mothers. Looking at the benefit ratio in that, we can see that the side effects are pretty low, and we don't need to be much concerned about that. But then what the female is going through, that is more serious, and that needs to be addressed. So
Yeah.
once we deal with her issues, she'll be able to take care of the baby in a better way. And these
Hmm.
are the side effects that can be easily neglected and are not going to be causing any long-term damages to the baby.
Yeah.
So this is one thing that uh, most of the people in our society believe that the psychiatric medicines are not safe, and
Yeah.
they have there's a huge stigma related to the medicines in psychiatry, that they cause a
Hmm.
lot of sedation, they cause some sort of a dependence, some kind of addiction. So all
Yeah.
those things are wrong, and people need to be more understanding of these things. That it is just like you have any other medical problems, it is also one of those. So you need to get treatment for that.
Yeah.
Along
I
with
think a
that,
lot is being said about mental health these days. There have been cases, whether it's in the celebrity industry or otherwise, that the importance of understanding that mental health is as important as physical health and needs to be diagnosed and treated properly. And it's not, you know, anything else, and that it's not that, depression just goes away one day. It just stays there. It is a medical issue. So I think people need to realize that as well and recognize it as actually an illness and not a syndrome.
yes, so most of the mental health issues, they are not just thought disorders, as people generally say. Most of the relatives, they come with patients and they say that this is something that they just think, and if they start thinking positively, they might not have certain problems. But then it becomes impossible for the patient who is going through such problems to not think positively. I mean, to
Mm-hmm.
have a positive thought is extremely difficult for them because of the medical illness. This is a kind of a medical illness that needs to be dealt with. So
Hmm.
this myth that most of the people have, that psychiatric problems are just something in their head, which can just go off with proper thinking or diverting your mind or doing something else. It is not so.
Hmm.
There is something actually wrong in that needs to be treated.
Yeah. And let's face it, ma'am, that sometimes families are not very supportive. Everybody goes through different situations and they may not take such things seriously, especially if there are elders in the family. They're like, yeah, yeah, this happens. It's okay, carry on. Are there any helplines or, some counseling helplines where women can just call and either speak anonymously or get some psychiatric or counseling help? Do such
Yes, there
helplines
are a
exist?
lot of such helplines. and there are lots of online forums in which they can even mention this, or they can talk to someone if they need help. They can even attend the group sessions, which there are group therapy sessions also for postpartum depression and such. The new moms, they can join such groups for psychotherapy, for supportive therapy. That helps a lot. In India, the culture is not so common right now, but there are in most of the metropolitan cities, such groups are there, and people can join.
Yeah, and I think you rightly said that there's a lot of help available online, in terms of articles, people's stories shared, and even like online appointments with, say,
Yeah,
professionals, medical
there are lots
professionals.
of online consultations, which most of the doctors, most of the psychologists, they also do. So they can also have sessions online. They can consult someone even for the medicines if they need an online prescription works. So there are a lot of changes occurring in the last few years, in which even the
Mhm.
online prescriptions and all those things also have started. I mean, legally it is acceptable now. Previously, there were a
Mhm.
lot of issues with that also, that only a hard copy of the prescription was needed to get the medicine. But that is
Mhm.
not so. So they can get help online through consultation to doctors also.
Hmm. Right. I think what women need to know here is that even if they are not getting support from their family members, or they just don't want to share it, there's always like an anonymous listening ear where they can reach out to, say, an online forum or a community or a self-help group, or even medical professional help if they think that their condition is really serious. Because it's really important, for a mother to be happy, to keep her baby happy and the family happy. So I think that
Yes.
becomes really, really important. And
And there are also certain,
yeah.
we have the rating scales for depression. So they need to be filled up by the moms. They can do that on their own also. So those skills are available online. So even during pregnancy, they can just fill up those questionnaires or uh, those skills, and they can get a result on their own. So they
Hmm.
can diagnose themselves whether they have depression or not. And if they feel that they are feeling depressed, then they can go ahead for taking any sort of help if they want to. So
Hmm.
all those things are easily available these days. It's just that they need to be more aware of their feelings and emotions, and we need to tell them that this is something that can be treated, and they don't need to suffer so long because
Yeah.
of the mental health issues. There is also a high risk of the babies getting damaged, because I mean they are harmed in some or the other way, because the mother cannot take care of her kid. So immediately
Hmm.
in the postpartum period, there are also some instances in which the female becomes psychotic if the depression is not treated. It goes to such a severe level that they start having delusions that the baby is deformed or having some defects, or it is just a sign of bad luck to them. And that can also lead to certain thoughts of committing, uh, I mean, of killing the kid or something of that sort. Also, it can lead to such severe consequences. So the
Hmm.
family members, specifically the spouse and the female herself, they should be aware that they can seek help for such problems if they're facing. In certain cases, the females themselves might not be aware of what they're going through. So the family members and specifically the spouse, they should be aware that these are certain thoughts going on inside her head. She needs to take care. They can get her a consultation, and um, treatment can be given in such cases. We also suggest in certain females, if it is very severe, that if they are having such thoughts of killing the kid, or even of committing suicide, then there is an option of ECT, that's shock therapy.
Hmm.
So, general public, they feel that immediately in postpartum period, giving shocks to the female is going to be some, that it could harm her, it could harm the baby, and the consequences could be bad. They could have side effects because of the disease, but it is not so. It is a very safe therapy, and the effects are, we can say, the fastest with ECTs. So within a week, there would be a lot of change in her mood, and she might get back to her normal self in about 15 to 20 days with ECTs. And with medicines, it takes some time. It takes about 3 months or so for her to get fully cured. So
I
in
believe
such
that
severe
those
cases,
cases
we
would
recommend
be
ECT.
very rare, or I'm just asking that those cases would be very rare, right? Where you would be doing, say, a shock therapy or for severe
No,
case.
it is not that rare. We
Okay.
administer this treatment very commonly because it is one of the safest modes of treatment. If we are giving medicines, then there can be certain chances of getting some side effects. Also, the treatment is delayed because of the medicines take about 15-20 days to start working. So, in the first few weeks postpartum, which is a pretty crucial time for the mom to be with her kid for the bonding period and all. So, during that period, if she's suffering and if she's not able to take care of the kid, we need to do something very quick. So, when we need fast therapy, ECTs, they are the best choice.
Sure. And okay, understood. Now we have some questions coming in from the audience. So, let's just take that and start answering their queries. Somebody's asked us, is insomnia a sign of TPD?
Sorry?
Insomnia, sleeplessness, I think.
Yes, it does happen. Just like in depression, there are a lot of sleep issues, sleep disturbance. Insomnia can occur with postpartum depression. In certain females, they might also have hypersomnia, that they might keep on sleeping. They just might not want to get up and feel extremely lazy and tired. So they might sleep for 12 hours, 15 hours a day. That also happens, and insomnia can also happen. So basically, sleep disturbance, like either increased sleep or decreased sleep. Either of the two can occur with postpartum depression.
Yeah, and another viewer has asked us that I feel like crying all day, but nobody understands. What should I do?
You need to tell your family members what you are going through, and you can even give them certain, you can tell them that you are going through postpartum depression and you need to take help. You can seek help online. You can consult any psychiatrist locally or online through any forum. You can also consult a psychologist if the symptoms are not that serious. But then, if you're feeling low and if you're feeling like crying all day, you need to seek help. And it is very much curable, treatable. So,
Yeah. And I think the
why should
first
we
thing that they
suffer?
need to do is they should feel that there should not be any stigma related to it.
Yes,
It's just
there is no
any
stigma.
other
Just like
illness.
any other medical problem, this is one of the medical issues that we need to deal with.
Yeah. Yeah. One viewer has asked us, how do we manage PPD without medication?
Depends upon the symptoms, the kind of symptoms that you're going through, and if you have just milder version of PPD, then with supportive therapy, reassurance, counseling, psychotherapy, all those things work. But if you're having severe symptoms and having sleep disturbance, severe irritation, crying all day, unable to eat, unable to take care of the kid, if all those symptoms persist for a pretty long time, more than 2 weeks, you definitely need medicines. And I don't think they should not take medicines. There's no reason particularly for not taking medicines.
Yeah. One more viewer has asked us, is it true that sad mood, negative mood, or postpartum depression leads to less breast milk production?
Not always, but then it can cause, because breastfeeding and production of breast milk, that is affected by your mood. So it can uh, cause certain changes in that, but not necessarily it can be because of the mood changes. So that needs to be evaluated by the gynecologist and by the psychiatrist. So it depends upon the severity of depression.
Right. And I think I just wanted to say here that, as a new mother, breastfeeding can seem like a challenge. It can, hurt physically, or it can be like repetitive, getting up multiple times in the night, and the child latching on for so long, which can also lead to tiredness and frustration. So in these cases, I think women can also pump their milk and have a family member to support them in feeding so that they can get adequate rest. And sometimes when it's like at earlier stages, like just panicking, guilt, or anxiety, taking adequate rest might help. What are your views on that, doctor?
Yes, definitely you need to rest your body because uh, childbirth itself is such a stressful period. It is a tiring thing, and the process that goes on even for a few weeks after that. That is feeding the kid, adjusting to the new motherhood. So all those things are stressful. Give yourself a break. Take rest. Even you can even put up some responsibilities to the family members that they can take care of the kid, and even the new moms, they need to be taken care of rather than just the female taking care of herself and the kid. So
Yeah.
take help as much as you can, rest properly, have good food, do whatever you want, take some me time out of that, and that is how you go ahead with this.
Yeah. And I think we are now at the end of our session, so we just take one last question, which is how to expect less from others and convince yourself to, stay calm and not spiral down that road. Can women, when they realize that they have started feeling low, or they are getting some symptoms, what can they do to control their mood, or is it something that's not in their hands?
Postpartum depression, if you're going through that, it is not in your hands because it occurs because of the neurochemical changes in your body and your brain. So that is something which is not in your control. So you
Hmm.
need to seek help for that. But in case of postpartum blues and the mood changes that generally occur in most of the females after pregnancy, you need to get involved in the activities that you used to like previously. You start exercising a bit, go back to your hobbies, do certain, start, rejoin your work. So those things which would keep you occupied, make you feel that you have not lost something or you're not sacrificing a lot of the things that you used to do, that would make you feel better.
Hmm.
Have proper sleep and food. Keep yourself healthy. Take care of your own health first before taking care of everyone around you. All
Yeah.
those things would help.
Yeah. I think that really sums up our session as well. I think women should take care of themselves, because a happy woman means a happy baby and a happy family.
Yeah.
And whatever said and done, you don't have to hold yourself to tall standards of motherhood. Everybody is a human being. Everybody has your own unique journey. And if there is some symptoms which are troubling you, which are making you feel low, please do seek help.
Yes.
So, with this, we say goodbye to our viewers, and thank you, Dr. Sweta Parikh, for being a part of this and answering all the questions we had and for our viewers. And I'm sure this is going to be extremely helpful for our mothers community.
Yeah. I hope I could be of some
Thank
help
you.
to them. Thank you,
Yeah.
Dr.
Thank you so much. Thank you, Doctor.